Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, everyone, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Rachel Michael, orthopedic surgeon with Monument Health Orthopedic and Specialty Hospital. Hello, Dr. Michael. I'm glad you're here.
Yes, I'm happy to be here.
We were talking a little earlier about broken toes, and I might want to get into that down the road a little bit. But what brings you out here to South Dakota? Why did you choose to do what you're doing, doctor?
Well, in med school, all the way back in med school, rotating through surgical specialties, I found orthopedics to be great because it's functional, right?
Yeah.
And everything we do is reconstructive, getting you back to the function that you once were at. So that's why I chose orthopedics and why I chose South Dakota. Honestly, it was the job position that brought me out here. The ability to treat all ages here with pediatric focus as well as adults. So it really was just the perfect fit.
So when did you realize that this was something you wanted to do? Do you have medical history in your family of doctors or?
No, the only medical person in my family was my mother. She worked as a surgical tech for a plastic surgeon. So I got pretty early exposure to that with the take your daughter to work days.
So those work. Yeah. They're very effective.
Yeah.
Oh, that's good to know.
Yeah.
So you got into orthopedics, and we'll start simple with this, I think, because when I was kind of researching this a little bit, I was surprised. You know, a lot of people I don't think understand the differences, as simple as it can be, between a sprain and a fracture and a break. I think the breaks are obvious, aren't they, generally?
Yes. So fracture and a fractured bone and a broken bone is essentially the same.
Right.
But I think some people will think a fracture is more hairline or where a break is a true, separation of the bone. But really they're equal. How
would you even know, I guess, if you had a fracture? Generally, then the bone it's not like out of place, right? Mm-hmm. Okay. So it hurts really bad and you're like, maybe I should go to the doctor. But what if you don't?
Well, it depends what age you are.
Okay.
So a lot of children can get what we call a green stick fracture, which is the bone will appear straight still, but it will be really sore because it just has like a bowing deformity to it.
Okay.
So those typically we treat with a cast, but if the worst case you didn't get in, they probably would heal just fine. They would just be very sore for a few weeks. But for an adult, the healing potential isn't there as much as it is in children.
Oh, I suppose not. Just like anything, the older you get, right. So you do specialize, though, in pediatric.
Yes. Well, okay. I'm essentially a general orthopedist.
Okay.
I did not do a peds fellowship. However, my training, we had extensive pediatric training within my residency.
Got it.
So,
okay. Yeah. And, I have a kid who's 16. And, of course, you can't put them in bubble wrap their entire life. And they are going to go out there and they are going to break things for sure. Mm-hmm. But why is there, it seems to be, is there more severity with a pediatric fracture than with adult fractures?
I wouldn't say severity so much as it's more you want to get to them sooner.
Okay.
And the reason why you want to get to a pediatric fracture sooner is because they start healing a lot quicker. They start laying down what we call a callus, which is a form of secondary bone healing. Basically, this disorganized bone collagen already starts getting laid down in between the broken bone fragments, which is great that they heal so quickly. But if that bone is not aligned perfectly or not aligned in an adequate alignment, then that healing sticks together and then we can't manipulate it. We can't reduce it with, just a cast or a splint. And then you're looking at a surgery to formally correct it. So that's why we like to get to them a little bit sooner.
Okay. So yeah, I guess if they heal wrong, then it's a much longer process and probably a little more painful process too, I would assume, in those situations.
Yeah, it is a little bit more difficult, especially the older kids, because pediatric fractures, they have this ability to remodel. So this remodeling potential is because of their open growth plates, which in the younger kids, bones don't have to be perfectly well aligned. We can accept a lot of deformity in them because of this remodeling potential, especially if they're younger, if it's a fracture closer to the growth plate. Basically you can have two bones overlying one another, and what'll happen over time is as long as it's set and or immobilized rather, as long as it's immobilized, the bones will heal together, and then it'll start to resorb on the one side where the bone shouldn't be, and it'll lay down bone on the other side where it should be.
Because your bone, it tries to fix itself, right?
Yeah, it does.
Okay, so yeah, that could be a problem then if you don't get it in and get it fixed. It's going to just it's going to try to do what it can do, I suppose.
Yep, exactly.
So, it's always probably best to err on the side of caution too if your kid is out playing and falls off a bike or runs into a wall or something and it's painful. You recommend get them in just to look at it.
I mean, especially if they're still complaining of pain, if there is any obvious deformity, obviously get them in sooner rather than later. But sometimes there's not a lot of deformity. Mom can take them home and give them Tylenol, Motrin, and if they're still complaining, I think it's worth just coming in, getting an X-ray, taking a look.
Is there a maybe this is going to be a hard question to ask? Is there a different type of pain that comes with a sprain or a fracture? I mean, will it be, because sometimes when you hurt yourself or bruise yourself, you know what that feels like, and kind of what's wrong. But does a pain get sharper with the fracture? Does it get? I don't think I'm asking this as good as I want to, but can you kind of tell?
So fracture pain is going to be a little bit more than your typical sprain, which a sprain is tearing or stretching of ligaments. So
has nothing to do with the bone. Generally.
Well, ligaments attach bone to bone.
Okay, got it.
So if you have a torn ligament, if it's ripped off the bone, or if it's stretched over the bone, then that could be a source of pain, and it could be a source of acute pain. But fractures are also going to be a source of acute pain. Strains, which is more the pulling of a tendon, so the tissue that attaches bone to muscle. It's hard to say because you can have swelling in both, particularly with ligaments and ligamentous injuries. You do get a lot of swelling, which it's hard to differentiate between a fracture. So that's why we just typically would get the X-rays. But
okay, yeah. So if your child ends up with a broken arm, broken leg, I mean, it's how much do you have to limit them from being a kid when that happens? Because it's got to be hard.
Yes. It is very hard, especially my younger kids. So typically we'll put them in a cast. Right. That'll protect them from themselves as much as possible. But really my limitations that I instruct parents on, but I also realize it's not always feasible. If it's an upper extremity injury, I usually say try to limit them from activities where both feet are off the ground. Okay. Trampolines, bicycles, climbing.
I just can't imagine some parent like, oh, my kid's got a broken arm, but the trampoline, go ahead, have fun.
You would be surprised. And so really just mostly because to prevent them from falling or having a high level fall when they're going to not have their extremity out to protect them from that fall. Okay. And also the cast material is stronger than their bone at that point once it's cured, so you don't want to break above or below your cast. Okay. Lower extremities, we say non-weight bearing.
That makes
good
sense.
Luck,
sure.
With some of the younger ones.
Okay, here's another kind of weird question that just popped into my mind. What is the easiest and the hardest bones to break?
Okay, so pediatric, and I think the rates are probably similar for adults. The highest one is the most frequently broken bone is wrist. So radius or ulna, so wrist or forearm.
I suppose it's just if you break your fall, you put your hands out, and that's okay.
Yep. So that's probably the most commonly broken bone, and then the least common is femur, mostly just because it's a harder bone to break. You have to have a much higher force of energy going through that.
I suppose car accidents and maybe things like that would be the way that would happen.
Yeah, typically.
Okay. Another question we've talked about around here before, and when you get I don't, we just get into some weird conversations about things, but when you have a cast on your arm, and again, I've never broken a bone, I don't think. So when you have a cast on your arm, how does it get removed? Because it looks like you're cutting into the cast when you're taking it off, right?
Yes.
But I think there's a big misconception about how that works, isn't it?
Right. So the saw that we use, it's an oscillating saw. So it is very loud. Its bark is much bigger than its bite, and it actually can't cut you, but it can burn.
Okay.
So especially my younger kids, when we go to take off casts, I warn them, I'm like, this is going to be really loud. It's going to be scary, but it's not going to hurt you. And so I'll even touch it to my arm. And I'll show them, see, it can't cut you.
Right.
And so once they see that, they calm down a little bit. So we just move it in and out of the cast material, and then kind of split it open, and then cut just with scissors the soft dressing that's underneath, and that's it.
So it's more of it's not literally a rotating blade.
It's an oscillating
It's a vibrating. Yeah.
Vibrating
okay.
blade.
That
Yep.
makes sense. All right. So moving forward, down in the future with broken bones and how we fix them and how they're repaired, is there any new kind of cool things that are coming down the pipe that you're aware of that might make, I don't know, healing faster? Casts not need to be on as long. I mean, are there things like this that are coming down that you find interesting?
Yes. So I don't know so much about the healing faster part of it.
I suppose there's nothing.
Yeah.
It's your body.
Yeah. But I did see, actually, there was an article I read, or somebody showed me like a week ago, that there's these really cool molded, somewhat air casts or something. And then basically you put this like gel molded cast over, and then you like suck it down, and then I don't know, it was very interesting, but it made it very waterproof. And
I suppose that's a big issue when you have a cast.
Yeah.
Break it in June, you're not in the pool.
Yes.
Until okay.
Yeah.
No, like 3D printing and things like that. Are those ways? Because that sounds similar to what you're talking about.
It was, but it was like a single mesh size, one size fits all, and then there's this machine that kind of sucked it down and hardened it.
Sure.
But I don't know how relatively new that is
Okay.
or where that's coming from. But I think there is definitely cast improvements that are coming down the line.
But also, it seems that there's things you guys have been doing forever that have worked, and really they don't need to change that much, right?
Right.
What's have you ever seen anybody or had to put in anybody? This is just terrible, into like a full body cast because they've broken so many. Have you ever been a part of something like that?
So. No.
Oh, that's good.
But like, I guess you could say a body cast. So in young kids that have a femur fracture, we actually put them in what we call a spica cast, which is a pseudo body cast. It goes up kind of to their upper diaphragm level, and it'll include the broken leg will include a full leg down to their ankle.
Okay.
And then there's the other leg is usually included up into the thigh. But there was a recent paper that came out that said you don't need to include the other leg. And so the last one that we did, we didn't include the other leg, and he healed up just fine.
Oh, that's awesome.
So it makes it a little bit easier on the diaper changes and certain things for the parents.
Boy, no kidding. Dr. Michael, this has been fun. I love talking about things, kind of different weird things that you experience, and I did want to get around to kind of what we talked about before we started, and that is so many people will stub their toes, hit their toes on things, and they never go to a doctor to fix that. And are the bones that different in a toe to where you could break it and maybe you don't even realize it?
Yeah, you could probably break a toe and not realize it.
Really?
And most often than not, broken toes typically don't require any surgical intervention. And we usually just put you in a hard sole shoe and let you, kind of take it easy for a while. for the most part.
Okay.
So,
Well, have you ever broke a bone?
yes, I broke my forearm when I was in 4th grade.
What'd you do? How did it happen? Was it embarrassing or was it a legitimate break?
It was a legitimate break, but it was embarrassing because it was at softball picture day.
Not during the game, during the pictures?
No, it was during picture day because we were waiting for our coach and everybody to get there, and we were jumping off the swing sets and decided I'm going to land in a handstand, and it was not the smartest move. So,
oh, awesome. Yeah. Dr. Rachel Michael, orthopedic surgeon with Monument Health Orthopedic and Specialty Hospital. Thank you for talking with me.
Thank you for having me.
And when anything else new comes along, I want to have you back, okay?
Okay, sounds great.
All right. Thank you, Dr. Michael.